Dr. Tansavatdi here. So I thought about, since we've started the new year 2020, I thought, what's the best thing that I can sort of provide as information for patients? And one of the things that I get asked a lot about is, what should I do for my skin? How do I take care of my results? Particularly, I have facelift patients who, after their surgery, they want to maintain their results. So I'm going to give you my top 3 things that I recommend as a maintenance for your skin that will hold up for the long term. So what are those? The first thing is skincare products. So I'm going to go over a few products that I think that everybody should be on. The first one being sunscreen. So we have one in our line, and I'm not going to go into too much detail about our line, but I'm going to show you for purposes so that you know which ones I use on a daily basis. I have that under my makeup right now. That's the Sheer Defense. And what that is you hear the term broad spectrum. So what is a broad spectrum sunscreen? That means it's covering UVA and UVB rays. The UVB is what causes a burn, and that's most prevalent in the middle of the day. UVA is what causes aging. So that's prevalent through the clouds at any time of day, can go through your windows of your car. So that's why we should be having sunscreen on at all times. I will hear patients who will say, but I'm not outside. Well, are you driving from place to place? You are certainly getting those UVA rays. So again, recommend a good sunscreen, an SPF 30 or higher. And you should reapply. So if you're indoors all day, before you leave for the day, if there's sun out, if there is even clouds, but there's sun underneath that, above that, then you should be wearing a sunscreen and reapplying it. Okay, so that's the first part, sunscreen. That's protection. That's preventing the aging signs. Now what can we do to treat the areas that have started to age? So first thing that I recommend is a retinol or Retin-A, a vitamin A product. Vitamin A products are essential for everybody, no matter whether you are young, in your 20s, or you're at my age. So let me tell you what are the benefits of vitamin A products. Vitamin A products give you several different things that can help your skin. First thing is exfoliation. I know patients who want to use scrubs because they love the feel of scrubbing their skin. When you're on a vitamin A product, you don't want to be using a scrub because the vitamin A product will exfoliate the dead layers off the surface of your skin. And another thing to know is if you do get regular threading or if you're getting waxing, you do want to stop your vitamin A product because they'll say that a vitamin A product thins your skin. That's not true. It's thinning the dead layers, surface layers of your skin, but it's thickening the dermis, which is what we want as we age because it thickens the collagen production. So that's the second thing that it does. For 1, exfoliate the skin. 2, it's thickening the collagen in our dermis. And 3, it's preventing pigmentation from forming. So one of the things that can happen as we age, as we get sun rays, is it can stimulate the melanin in our skin cells to produce more pigment. So you get those brown spots that pop up, and we call aging spots. Those are what the Retin-A product is really beneficial for. So vitamin A product, either Retin-A as a retinoic acid or retinol. So that's those 2 products. The last one is a vitamin C product. CE, ferulic serum, is one way to really drive the vitamin C into the skin. You can also look at, we have one that's a gel, a serogel. Vitamin C is also an antioxidant, so it helps to scavenge for those radicals, the DNA breakage that can happen from the UV rays. That's what you want to use vitamin C for. It prevents those free radicals from developing, causing more damage to your skin. Vitamin C is also to help with pigmentation production. It is also a cofactor in the production of collagen. And there you go again. Okay? So those are the 3 products. Next thing I'm going to move on to, so these are products, skincare products, basic line. Everybody should be on that. Second part of it is IPL. You're going to ask me, so what is the benefit of IPL? So IPL is something that I recommend that everybody be having 1 to 2 treatments a year. IPL on top of the skincare helps to boost you because let's face it, during the summertime, we're gonna put our sunscreen, but we might not do it on a consistent basis. And if we're outside, we are gonna get some sun damage. So what an IPL does is it helps, one, to stimulate collagen, very minimal though, the collagen production, but I do want to say it does stimulate collagen. Two, it takes care of pigmentation. And three, it takes care of red spots. As we age, our skin thins, and so what you'll see is capillaries that will be more superficial and more visible in the surface skin. So if you're above 40, like myself, then I would recommend 3 to 4 times a year. If you are getting into your 50s and 60s, I actually recommend 6 times a year. So that's every 2 months. I know that's quite a bit, but as we age, the production of collagen goes down and it starts to dwindle pretty quickly. So we really need to have treatments that boost our skin. So that's IPL. And then the third thing I recommend is microneedling. This is another way to really boost the skin with good collagen. I'm going to harp on that over and over again, which is collagen production really starts to take a dive after our 20s. And the only way to get that collagen back up is not by pills. I know people ask me about collagen pills, but it's actually by stimulating collagen production. One is in Retin A or vitamin A product. Second would be with the IPL treatment. Third would be by microneedling, which is traumatizing the skin. Little tiny traumas that we make in the skin stimulate the collagen production in the dermis. And you want to go deep enough to where you get bleeding, because the bleeding signifies that you are in the papillary dermis, where the loops of the capillaries come up. And so if you get little bleeding, that's the depth that you want. Some of the home microneedling devices, they don't go to the depth that we need. So I do recommend coming in for regular treatments of microneedling. Thank you for tuning in. For more information, please visit our website at www.facesbydrt.com, and you can also check out my other videos on YouTube at the handle FacesByDRT1, and also our Instagram posts at FacesByDRT. Thank you very much for tuning in.